This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Today is our second anniversary. Can you believe it? The show's not only still alive, but going strong. Thanks to you, your interest, and your enthusiasm. I'm genuinely grateful you've traveled with me this far. And don't worry, we've barely scratched the surface of poisons and toxicology. Our episode today is called Hooch. Do you want to know what poison is the most potent known to man, yet is ubiquitous in nature? How you can be poisoned by a prison potato? Then listen to find out. Today's episode starts in the emergency department. You see a patient being wheeled into room 5. He's wearing an orange jumpsuit, is handcuffed to the stretcher, and accompanied by 2 prison guards. The intern goes to see him, then presents the case. It's a 34-year-old man whose chief complaint is weakness. The patient reports feeling generally weak all over. He also complains of blurry vision and difficulty swallowing. The illness started 3 days ago with nausea and crampy abdominal pain. He was seen for the same symptoms in the ED yesterday, and his workup included an unremarkable CT scan of his brain, normal labs, and a normal urinalysis, after which he was discharged back to prison. Today, the neurological symptoms are not only ongoing, but worsening. He feels like his arms are weaker than they were yesterday. He reports the abdominal pain and the nausea resolved, though he's constipated and hasn't had a bowel movement in 3 days. He denies any past medical history, reports no medicines or supplement use, and has no allergies. On exam, his vital signs are temperature of 98.6 Fahrenheit or 37 Celsius, blood pressure 120/80, a heart rate of 80 beats per minute, respiratory rate of 18, and oxygen saturation 100% on room air. The intern's unsure what to make about his neuro exam, so you go to the bedside to examine the patient together. You test his cranial nerves, those originating from the brain and the brainstem rather than the spinal cord, and controlling things like smell, vision, and facial muscles. The patient's eyelids are droopy, though it's hard to tell if this is just how he normally looks or if they're actually weak. His pupils are large and minimally reactive to light. He's a big muscular guy, so it's kind of hard to tell for sure, but he does appear to have subtle muscle weakness in his arms. You can't elicit the reflexes either. You and the intern return to your desk. You review the results from yesterday, all normal, not even a hint of any abnormality. You ask about tobacco, alcohol, and drugs. The intern says the patient denied smoking, but the intern didn't ask about alcohol and drugs given the fact that the patient is in prison. In fact, drugs are widely available in prison, and medical care of prisoners can be challenging for a number of reasons. Often preventative care is lacking, and complaints may be dismissed or attributed to malingering, complicating the picture. So what about our patient? He was already seen and evaluated yesterday for vague complaints. Is he malingering? The hospital is often preferable to prison thanks to violence, mental health issues, drug use, gangs, etc. But no, our patient has neurological findings on exam. They're subtle, but they're present. Ptosis, the medical term for droopy eyelids, suggests weakness of the third cranial nerve. His pupils are large, and while this could be due to drugs of abuse like sympathomimetics, methamphetamine, or cocaine, but his vital signs are normal, so it's more likely from something else. His arms seem weak, and we can't elicit his reflexes. Is this due to a stroke? No, strokes cause unilateral, one-sided, not bilateral symptoms. Encephalitis and meningitis can certainly cause neurological problems, but typically he'd have fever, headache, neck stiffness, etc. Electrolyte disturbances like low potassium and high magnesium cause weakness, but his labs yesterday were normal. I'd definitely be concerned about Guillain-Barré syndrome, a disease causing descending paralysis. It can occur after exposure to infections like bacteria or viruses, rarely after vaccines, or sometimes there's no known cause. Myasthenia gravis and multiple sclerosis are both concerns. We need neurology to help for sure. Anytime you consult neurology, they love to recommend 2 tests, MRIs, and spinal taps, so we might as well do those now. The intern orders a brain MRI and sets up for the spinal tap. If the patient does have Guillain-Barré, the CSF protein will be elevated, and in addition, the spinal tap will rule out infection like encephalitis. In the meantime, you call the hospitalist to get the patient admitted. The next day, the intern updates you. The patient's MRI and spinal tap were negative, ruling out MS, Guillain-Barré, or meningitis and encephalitis. But overnight, the patient became progressively weaker. Now he can barely lift his arms off the bed, and his legs are affected as well. He's also having difficulty breathing and has been moved to the ICU. This isn't a neurology podcast, it's a toxicology podcast, so let's talk about toxicologic causes. I love carbon monoxide for vague complaints with subtle neurological findings. However, the entire prison would have to be sick, so no. Coral snakes can cause paralysis, not likely in prison, and same with tick paralysis. Paralytic shellfish poisoning, we've discussed previously. Again, not likely if nobody else in the prison is sick. Heavy metals can certainly cause peripheral neuropathy and abdominal pain, so I would keep it in the back of my mind, but in truth, his symptoms don't really fit with things like lead, arsenic, or thallium, for example. Based on the patient's symptoms of a descending flaccid paralysis, what toxin might this be? That's question number 1, and it's time to pick your poison. Is it A, tetanus, B, strychnine, C, botulism, or D, poison dart frog venom? The answer is C. This is consistent with botulism toxicity. Tetanus and strychnine cause rigidity, not flaccid paralysis, and poison dart frogs cause flaccid paralysis via batrachotoxin, but it's really rapid with immediate onset in minutes. It's not a progressive worsening over several days. Botulism toxicity causes descending paralysis, meaning the symptoms start at the top and move down. Patients initially complain of difficulty swallowing or blurry or double vision. And as with our patient, they often present for medical care, but given the vague symptoms, they're commonly sent home, only to return with progressively worsening symptoms. So, we're concerned about botulism. How do you make the diagnosis? Good question. You can test for botulism in a number of different bodily fluids. We commonly use stool and blood. And actually, the specimens are generally sent to the CDC for specialized testing. The CDC typically does anaerobic cultures and a mouse bioassay, meaning they inject the specimen into a poor mouse to see if the mouse dies. After discussion with neurology and the hospitalist, you contact the CDC, who agrees with your suspicion and agrees to run the tests. What's the treatment for botulism toxicity? That's question number 2. A, supportive care. B, Prussian blue. C, Narcan or naloxone. Or D, botulinum antitoxin. The answer is D. We actually have an antidote, botulinum antitoxin. In the U.S., the CDC keeps stockpiles near major airports and airlifts it to hospitals when needed. It's a heptavalent antitoxin, meaning it treats all 7 botulism subtypes, which are labeled A through G. Certain subtypes are more prevalent in certain geographical areas or with certain types of infections. Only 3 subtypes typically affect humans, and we used to use a trivalent antitoxin effective against those 3 subtypes. But given the recent concern for botulism use in terrorism, the heptavalent antitoxin was developed, and that's the one we now use. The CDC agrees to release the antidote, but it will take some time to arrive at your hospital. In the meantime, the patient worsens, developing respiratory failure. Why? Remember, the diaphragm is a muscle, and if it's paralyzed, you can't breathe. While we wait, let's talk about how people are exposed to botulism. Was there a canning mishap in the prison? There are a number of different types of botulism poisoning, so we'll start there and then come back to our patient. First is the one everybody knows about, foodborne botulism. This is when you eat food containing botulinum toxin, classically yes, from canning gone wrong. The toxin is produced by the bacteria Clostridium botulinum, and Clostridium is found literally everywhere. It's ubiquitous in soil, seawater, it's even in the air. The spores are extremely hardy and can survive in very difficult conditions, including boiling for hours at 212 degrees Fahrenheit or 100 degrees Celsius. They are, however, destroyed within 30 minutes at temperatures of 250 degrees Fahrenheit or 120 degrees Celsius, and thus the strict precautions for canning food. You know, I love pickles and I wanted to make some homemade pickles one day, but the first 10 pages of my cookbook detailed very specific, very strict techniques for boiling and sterilizing, and I got so worried picturing the consequences of a mistake. To this day, I've never made any homemade pickles. The second type of botulism toxicity is infant botulism, and this is actually the most common kind in the U.S. In the U.S., foodborne botulism accounts for about 15% of cases and infant bot about 75% of cases. And the incidence of this disease is highest in California, New Jersey, Pennsylvania, and Maryland, though why isn't exactly clear. It occurs in babies less than 6 months. They ingest Clostridium botulinum spores and become sick. After 6 months, the GI tract develops enough to keep the bacteria from growing inside the body. We describe the presentation as a floppy baby due to diffuse muscle weakness. The babies have difficulty feeding because their sucking reflexes are weak and they have very weak cries. They also have constipation. This type of botulism actually has a separate treatment. It's called baby big for botulinum immune globulin. Question number 3, what food is associated with botulism in babies? A, honey, B, peanuts, C, cow's milk, or D, eggs? The answer is A, honey. This disease is the reason why parents are advised not to give honey to babies until the babies are 1 year old. I certainly wouldn't go against this recommendation. I will say, however, that the evidence is extremely weak when you review it, and we don't really know why some kids develop this problem and others don't. A third type, wound botulism, occurs in the setting of IV drug use, where the wound is dirty and becomes contaminated. In the U.S., this accounts for about 12% of cases, and it's classically associated with the injection of black tar heroin. The other types of botulism are extremely rare. There's a type occasionally seen in the gastrointestinal tracts of patients who've had GI surgery. Iatrogenic botulism is due to therapeutic misadventures with botulism toxin. Inhalational botulism is on the list of potential biological weapons and interestingly caused toxicity in 3 veterinary workers after they inhaled botulism from animal fur. So what does the toxin do once it gets in the body? Botulinum toxin is considered the most potent toxin known to man. 1 microgram is enough to be lethal in humans. Once the toxin gets into the bloodstream, it travels to nerve terminals and is taken up into the neurons. It then blocks the release of acetylcholine into the space between the neurons called the synapse. This means nerve impulses can't be conducted and muscles can't contract, resulting in flaccid paralysis. How does the antidote work? Pretty simply by binding to the botulinum toxin. It's another antidote, we've talked about several, which is an antibody and simply binds to the toxin and inactivates it. Now, one interesting thing is it can only bind to the circulating toxin. It doesn't get inside the neurons or other cells, meaning it stops progression of the disease, but it can't reverse paralysis that's already occurred. So back to our patient. What then is his prognosis? Fortunately, he got timely medical care and intubation, so I'd expect him to recover, including to recover his muscle strength, though the recovery will take a long time, weeks and probably more likely months until he gets back to himself. The earliest case of botulism toxicity was in 1735 and attributed to improperly cooked blood sausage in Germany. In fact, botulus is the Latin word for sausage. Foodborne botulism is not surprisingly most often associated with home-cooked food rather than commercial food. So bringing us back to our patient, how the heck did he get botulism in prison? Well, the health department and the prison officials are conducting an investigation. And before he was intubated, they interviewed the patient. He denied eating anything other than prison food. Records confirmed he hadn't recently had any visitors who might have brought him homemade food. Question number 4. What U.S. state has the most foodborne botulism cases? A, California, B, Pennsylvania, C, Alaska, or D, Hawaii? The answer is C, Alaska. Why Alaska? Well, fermented food is another common source of botulism. This includes things like fermented fish, fish eggs, seal, and whale meat. And interestingly enough, about half of U.S. foodborne botulism cases occur in Alaska, despite Alaska having only 0.2% of our population. And this is because of the popularity of those types of fermented foods, reflecting the historical challenges of surviving in an extreme environment. An interesting example from Greenland is called kiviak, hopefully I'm pronouncing that right, where seabirds are caught and sewn inside a seal carcass to ferment and then eaten several months later. Unfortunately, botulism might also ferment along with other things. Anything that can go wrong will, is what I think about botulism. In one interesting case, several people developed botulism toxicity after drinking peyote tea. The cactus buttons were covered in water and stored in a jar for several months, so it also unfortunately brewed botulism. Was our patient poisoned by the prison kitchen? Well, it's always possible, but if so, why is he the only person affected? The words prison and botulism together bring to my mind one word: pruno. This is prison moonshine or hooch, and prisoners will try to brew alcohol inside the prison from regular food items like fruit. There have been several outbreaks of botulism due specifically to pruno. In Utah, 8 men ended up on ventilators, and in Mississippi, 31 patients developed botulism toxicity after drinking a contaminated batch of pruno. The epidemiologist from the health department confirms your suspicion a few hours later. She sends you a picture of a Ziploc bag filled with a cloudy yellow-green liquid found hidden inside the patient's toilet. I'm trying not to gag just thinking about this. She says 2 other inmates drank the pruno, but both spit it out due to its foul taste, thereby saving themselves from exposure. Different recipes to make pruno exist, but basically it's food fermented into alcohol, as I said, often made from fruit, but sometimes things like corn syrup, sauerkraut, hard candy, bread. ketchup, essentially whatever's available. The case in the Utah prison was traced to a potato used to make one batch, which had been saved for several weeks before it was added to the pruno. In addition, the mixture was strained through one of the inmates' socks. If this isn't bad enough, in addition to botulism, you can also get methanol toxicity from pruno as well. Nauseating details aside, there's a really moving poem by a man named Jarvis Master called The Recipe for Prison Pruno, which he wrote while on death row. It actually won the Penn Award for Poetry in 1992. If you're interested, take a look. This case is a fictional case, as are all our cases to protect the innocent, but it is based on real cases. Now, this is the great thing about toxicology. We can move right from prison to cosmetics, because could we talk about botulism without talking about Botox? No way. Question number 5. Cosmetic Botox injections carry a high risk of systemic botulism toxicity. A, true. B, false. The answer is B, false. The risk of systemic botulism toxicity is extremely low after medical or cosmetic procedures if it's injected by a licensed practitioner. In medicine, we use Botox to treat chronic migraines and for muscle spasticity, just to name a few. There is a risk of muscle weakness in unwanted areas such as the eyelids or the neck, but it's very uncommon and the effects wear off as the toxin does. That said, iatrogenic botulism toxicity occurs because things can go wrong, rarely with licensed practitioners, as I said, but unlicensed ones are a completely different matter. There's a crazy case published in the New England Journal in 2006, which highlights the risk. A physician ordered Botox for his clinic. The vial was labeled for laboratory research and not intended for human use. Nevertheless, the clinic diluted the Botox to use on humans. Not incidentally, the physician's medical license was already suspended for selling narcotic painkillers for profit. He administered this Botox, injecting it into his own face, his girlfriend, and 2 patients, a husband and wife. He unintentionally gave 2,800 times the lethal dose of botulinum toxin. They all, including him, developed toxicity with weakness and respiratory failure. They were all intubated, and they were all treated with the antitoxin. Fortunately, they survived. The physician pled guilty and was sentenced to 3 years of prison. Why did he use that vial? Apparently, it was cheaper than the medical-grade preparations. Yikes. In another case, 68 people were poisoned at a hospital in Turkey after stomach Botox. Yes, you heard that right. I had no idea this existed, but apparently you can have Botox injected into your stomach via an endoscopy for weight loss. Supposedly, it makes you less hungry, though the evidence, not surprisingly, doesn't support its effectiveness. It seems awfully invasive to have a procedure to inject something that lasts only for a few months anyway. This is a whole nother topic and will make a great future episode, the price and toxicity of beauty. Bringing us to the last question in today's podcast. The Japanese called Shinrinko grew Clostridium botulinum and tried to cause toxicity by spraying it near U.S. naval bases, Narita Airport, and the Japanese Imperial Palace. Fortunately, no one was affected, including the cult members who accidentally exposed themselves. The cult, however, was responsible for killing 13 people and injuring nearly 1,000 in an attack on the Tokyo subway system. What toxin did they use in this attack? A, VX, B, cyanide, C, arsenic, or D, sarin? Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Thank you. Until next time, take care and stay safe.